We are very proud of our vaccination clinics. To date, we have provided over 10,000 doses, with many of those vaccinations going to the most vulnerable populations in Oregon. And amazingly, we have vaccinated more than 90% of our employees and local student populations.
Getting the vaccine is super important to just, do our civic duty and be able to return to life as normal. Hopefully, we'll be able to return to campus next year and bring back all the fun parts that we've missed out on, like going into the UC and studying and just returning to campus life and being able to spend time with the people that we care about the most.
So yes, we are proud of our vaccination clinics, both for what it means to Pacific University to have its faculty and students vaccinated, but also honored to give back to the larger community. The pandemic has been a wrecking ball in the lives of Americans already struggling. Economic losses and health outcomes alike have been worse for the elderly, for people of color, and for people living in poverty. As you know, in late February, we hit 500,000 Americans who have lost their lives due to COVID-19, including at that time 2,155 Oregonians. We all want to return to normalcy. Safe and effective vaccines are the key to achieving community immunity against COVID-19 and making that return a reality.
I'm so grateful that they're offering this to students and to the faculty because we're like an own little community, and I'm really impressed on how Civics actually handled the situation. And yeah, I definitely wanted to get vaccinated, for my health, for public health, and for everyone else's health.
While distribution efforts have taken time and the rollout stunted, Pacific has been a valued partner to both OHSU HMC, formerly Tuolity, to Washington County, and to OHA. It all came about with the donation from OHSU HMC of 600 doses to allow Pacific to vaccinate its healthcare employees and students. In 1 week, the vaccination team, a group of dedicated employees, pulled together the location, logistics, permitting, paperwork process, and volunteers to vaccinate 600 Pacific employees and students. This was in late January, and vaccinating 600 people over 2 7-hour days was a great accomplishment.
Una silla a que me ponga la vacuna. I'm heading over to get my vaccination at this particular time. I'm really excited. Un poco nerviosa, a little nervous, pero todo va a estar bien. All is going to be good.
However, just a few months later, on April 17th, Pacific vaccinated 1,400 individuals in 6 hours. We are a vaccinating machine with new efficiencies developed at every stage of the process. From traffic control to vaccine administration, we have improved and increased access for non-English speakers, for the illiterate, and for those who just can't use today's technology. This newfound expertise has been greatly appreciated by OHA and Washington County. It has allowed Pacific to become a reliable partner to them as well as other community groups like Centro and Washington County's Pacific Islander community. We are also really proud of the fact that we have created a very efficient means for both scheduling and obtaining our documentation. That's a lot of extra work, and we have come up with very sophisticated but easy to use platforms.
The other big part of this is that overseeing custodial, we have a lot of non-English speakers that were able to get in for their first shots, and many of them thought that they would never become eligible or be able to find a way to get them, so it's been very touching.
We create alternatives by providing access to classroom-style education about vaccines in both Spanish and in easy-to-understand explanation settings. We have been able to assist the Latino population and the elderly and have helped to combat vaccine hesitancy. With our hybrid clinics allowing for walk-up and drive-through, we assure access to those with and without transportation, and in particular, the drive-through clinics allow us to serve those with mobility challenges and our elderly populations. From taking the time to provide real-life explanations, we have taken and implemented practical solutions. This was all made possible by the more than 20,000 volunteer hours by the Pacific University community from every department and program on our campus, including many alums and retirees, as well as our board members. Many of our health students have pulled double duty, repeatedly volunteering at our clinics. When the pandemic first hit, it decimated many of our student placement opportunities. So the clinics have provided a true teaching ground for our physician's assistant and pharmacy programs. Recently, the laws changed, expanding the healthcare groups that could vaccinate to include optometry and dental hygiene.
Officials expanding the list of people who can administer COVID-19 vaccines.
This means professionals like veterinarians and optometrists could soon start giving out the shots. Elise Haas shows us how it will all work.
Public health officials have told me that it's not necessarily the supply that's the problem, it's really the vaccine infrastructure in this state. And so they've been trying to do whatever they can to stand up their vaccine infrastructure. Of course, there's rules and regulations to this. They must be currently licensed, certified, or registered. We've already seen how this work is helping and playing out at Pacific University, where their coordinator of vaccine clinics says they've already vaccinated up to 3,000 people with the work of their physician assistant and pharmacy students who have been eligible to do this from the get-go. And they are thrilled now that dentistry students and their optometry students are going to be eligible now too. All of their students are overseen by a supervisor. The vaccination clinics they run are big, outdoor drive-through clinics, and they'll be able to run multiple clinics, one at their stadium and one at their optometry school, now that those students are eligible to give shots as well.
Running a clinic takes more than putting shots in arms.
It takes logistics and a strong team behind it. During COVID, healthcare students have been impacted.
We had students, PA students, physician's assistant, and pharmacy students who lost their ability to go out into the community and serve and actually get the experience that they typically would.
But healthcare students at Pacific University are getting experience at the vaccination clinic in the Forest Grove Stadium parking lot.
We're doing good, which we love, but we're also providing a real life experience for our students. And so our physician's assistant students, PA students, and our pharmacy students are doing the majority, basically all of the vaccinations, other than some of the student health center staff who also does some during the day when the students are in class.
Pacific University is working with Washington County. They've also done 6 community clinics as well.
Putting out several thousand vaccines and really working closely with Central to make sure that we were able to vaccinate a large portion of our Latino population in Washington County. We need to be able to vaccinate more. There's a lot more vaccine available. And now with optometry being able to do vaccinations, and they have a lot of students. Our optometry program is large. And so there's a lot of students who are knowledgeable and capable of doing vaccinations.
I wanted to be a part of the first response of COVID, and I wanted to help assisting with the COVID vaccine rollout, and so we all can get back to our normal.
It's definitely been strange. It's kind of sucked to be isolated from some of my friends who live in different dorm buildings, but I'm hoping that with everyone getting vaccinated, next semester will be a little more open.
I came to Pacific as a student because of the mission to serve the community. And I came back as faculty with that same drive to pass that on to students and then to respond to the pandemic this way. Even though it's hours and hours of work, this is what we're here for. And this is what we're training our students to do.
So with 10,000 plus already vaccinated and a plan to continue to keep our community safe, we can count Pacific University as leaders in the fight against COVID-19. The entire Pacific community, its employees, students, alums, board members, and supporters have taken part in this historical work of vaccinating. At Pacific University, our mission is more than words. It is something we live and breathe and do. Pacific University, to inspire students to think, care, create, and pursue justice in our world.